Coming up on Family Health Today, we'll take a look at a unique charity that is helping hundreds of uninsured Americans. Later, we'll get the details on a 14-person kidney transplant and how a popular U.S. company is keeping their employees fit. Family Health Today is next.
Welcome to Family Health Today, Arkansas's only weekly in-depth look at the medical and health issues that affect you and your family. Brought to you by Jones Television, in cooperation with our sponsors, Northwest Arkansas Heart and Vascular Center and the Arkansas Democrat Gazette.
Hello, welcome to Family Health Today. I'm Dr. Janette Nesheiwat. The battle over health care reform is being taken from the halls of Washington to cities across the nation. With lawmakers taking a summer break, now the debate is reaching the grassroots level. Sandra Endo talked to two people with opposing views about why they're joining the health care debate and willing to hit the streets to talk about it.
Non-stop lists, to-do lists.
Dan Sherry takes us behind the scenes, where he and other volunteers are getting ready to rally for health care reform. For Dan, the battle is personal.
And the day the insurance company took away my insurance, my life expectancy dropped 2 years.
He says a couple of years ago, he was busy running two small businesses and missed one health insurance payment. Dan says the mistake knocked him and his family off their policy. He was able to get his wife and 3 kids back on, but Dan was denied since he was previously diagnosed with high cholesterol.
But they wouldn't insure me anymore because now I had a pre-existing condition, high cholesterol.
He's taking his fight to the streets.
Yes, we can!
Joining the healthcare debate at the grassroots level, volunteering with a group called Healthcare for America Now, a coalition of advocacy groups including the Healthcare Workers Union, ACORN, and the NAACP, who are pushing for the administration's healthcare initiative.
Read the plan!
Here's where policy and protest collide. A pro-healthcare reform rally over here, just across the street. The counter-arguments.
Healthcare freedom!
These rallies for and against the issue are scheduled throughout August to send a message to lawmakers during their summer break. Both groups also send members to ask tough questions at town hall meetings, sometimes turning the events into shouting matches. American Liberty Alliance is one of the groups organizing people against health care reform. ALA claims credit for helping to organize the anti-tax Tea Party rallies in April, a movement which started through Twitter. Corrine Williams decided to join their effort a couple of weeks ago.
Just say no!
While on this day the anti-health reform group is not as large in numbers, Corrine is helping to organize a major rally for later this month, a nationwide event. For her, she says, the proposed reforms just don't feel right.
I don't like the idea of the government saying, this is what we're going to let you, this is what the kind of treatments we're going to pay for, these are the kind of doctors you can go to. I want to have control.
As complicated as the healthcare debate may be, for the grassroots effort, it sometimes boils down to taking turns being on each side of the street. Sandra Endo, CNN, Chicago.
Many of these organizations rely on the internet for small contributions to fund their cause, tapping into online meetup groups and databases first created during the election season. Well, if you're wondering just how the tens of millions of uninsured Americans get their health care, you're about to find out. They rely on charities like Remote Area Medical, based in Knoxville, Tennessee, to provide services for free. Jim Acosta has more.
It started before sunrise. People in wheelchairs and holding babies waiting in line for their number to be called.
So, who's got number 1?
I do.
Okay, come on down. Come on down.
And with that, the doors were opened.
141, where you at?
Within minutes, the charity organization Remote Area Medical transformed this high school in Tennessee into what looked like a hospital for the uninsured.
We have had to cut back on our operations in places like Haiti and Guatemala and India because of the tremendous demand here in the United States.
We're getting into the nitty-gritty here. The group's founder, Stan Brock, took us on a tour of his operation that provides medical, dental, and even eye care at no cost.
And all of these people that you're seeing here, and all of our support staff, they're all doing it for free.
The licensed doctors, dentists, and nurses fly in from across the country on their own dime. Some patients can barely make it through the front door.
The way my blood pressure was so high, I might have had a stroke, you know.
If these folks weren't here?
Yeah.
Need your teeth pulled? No problem. Need glasses? Stan's got them. And this is all free?
And absolutely free.
But Brock says it's Washington that could use the glasses. Would you like to see the president? Would you like to see members of Congress come to one of your events and see these folks firsthand?
Oh, well, I think that would be a marvelous idea. Nothing would please me more than for us to be put out of business here in the United States so that we can concentrate on these places where the need is so desperate.
One thing Brock and his volunteers can't stand, turning people away.
Seeing the lines here, seeing the need for services in so many ways is very clear evidence that we need healthcare reform in this country.
As the sun was setting, Remote Area Medical had treated nearly 500 patients, and there were cars lining up for the next day.
Don't be late. Thank you very much.
Thank you.
The battle over healthcare reform isn't just about universal coverage. It's also about controlling Medicare costs. One little-known Medicare benefit that regulators are watching closely, hospice care. It's supposed to save you money, but does it? Jerry Willis takes a look.
Big deep breath.
Carol Batiste is dying. The Oklahoma rancher and convenience store owner suffers from an incurable lung disease, and doctors don't know how much time she has left.
They said they could make me as comfortable as possible, until there's nothing else, they can do, because there's just no cure for it other than the good Lord above.
Carol's doctors have tried to ease her burden through hospice care. Hospice provides pain management, medical, emotional, even spiritual support for terminally ill patients at home.
My kids and my family and just my home, it means a lot to be here.
Medicare established the hospice benefit in 1982 to save taxpayers money.
We keep them out of the hospital. The research shows that the biggest Medicare dollar is spent in the last 30 days of life. And why? It's because they're in the hospital, they're usually in intensive care units, receiving high dollar care, and in most instances, care that they really never wanted.
I'm going to give your arm a hug.
Hospice has grown rapidly in the last 10 years. To help control costs, Medicare will pay a maximum of $22,400 per patient, allowing roughly 6 months of care. But there are a growing number of patients like Carol Batiste who are terminally ill but living longer than doctors expect. The hospice provider often cares for them as long as necessary, and Medicare continues to pay past established caps. When they outlive the cap, the hospice provider is then forced to pay back Medicare thousands, sometimes millions of dollars. As a result, some hospice providers have started restricting admissions, discharging patients, or closing down completely.
The cap teaches hospices through punishment, through financial punishment, not to admit those patients who might live a little bit longer or more unpredictably.
Hospice care spending will only increase as baby boomers age. Medicare currently spends about $10 billion per year on hospice, but the cost is expected to grow to $13 billion by 2010. The Centers for Medicare and Medicaid Services, or CMS, declined our request for an interview, but a recent CMS report found hospice expenditures are projected to grow at a rate that outpaces those for hospitals, skilled nursing facilities, physician services, and home health care. But family members whose loved ones get to spend their last days at home say you can't measure their care in dollars and cents.
How do you put a price on your mama or your wife or your daddy, your grandma, your brother, your sister?
Even with the hefty price tag, hospice providers say the program still saves Medicare billions. But government officials insist they must watch costs because with current spending patterns, Medicare is expected to be bankrupt by 2017. Well, school may be out for the summer in California, But the H1N1 flu is still going strong. So health officials in Santa Clara County are turning to the internet for help. They're developing a back-to-school flu awareness campaign that focuses on social media such as Facebook, MySpace, and Twitter. Craig Sklar has more.
Health officials in Santa Clara County say they're bracing for a lot of flu cases and not much to fight it with. They don't expect a flu vaccine until sometime in October at least, and even then its effectiveness will take even longer to kick in.
Regardless of when we get the vaccine, there's a lot of dollars in this kind of thing.
Again.
Regardless of when we get the vaccine, there's a lot of time that flu will be circulating, and this new flu will be circulating, and we won't have protection in our community against it.
The health department is especially concerned about schools once they go back into session. With people under the age of 24 especially vulnerable, they expect the threat level to grow. So now they're fighting swine flu using the internet. Since kids are of the greatest risk and they tend not to read newspapers or watch TV news for information, the health department is turning to websites like Facebook and MySpace, putting out information where they'll see it about how to limit exposure and take preventive measures. Those sites are expected to be up and running in the next 2 weeks. So far, the flu is not getting more severe here, but the high number of cases in the southern hemisphere, where it's currently winter season, is a sign of more trouble to come once summer is over.
Marijuana activists in California want pot on the ballot. They've taken the first steps to getting a vote on legalizing pot. Lillian Kim has the story.
This is 25 square feet, so this is a 5 by 5 foot. This was
if Richard Lee gets his way, a 25 square foot plot of marijuana plants at your home would be legal, as long as it's for personal use. And so would possession of up to an ounce of pot for adults 21 and over.
I believe in democracy, and I think it's time for the debate.
Richard Lee is founder and president of Oakland's Oaksterdam University, a trade school for the medical marijuana industry. Lee filed paperwork today that would put the pot legalization issue on the November 2010 ballot.
Cannabis doesn't kill you. Alcohol, we have overdose deaths every year. Alcohol causes violence. Cannabis does neither of those. So citizens should have the right to choose a less dangerous substance.
Pot activists also say by making pot legal, the state could then tax it, which could bring in nearly $1.4 billion a year. Even so, former San Francisco Police Chief Tony Rivera says legalizing marijuana is a bad idea.
It compromises your ability to drive a car. Many compromises your behavior. Of course, you can make comparisons to alcohol, but again, I'm not arguing here that alcohol is a good thing.
According to a recent field poll, 56% of California voters support legalizing and taxing marijuana. Even the governor has said it's time to debate the issue.
I think all of those ideas of creating extra revenues, I'm always for an open debate on it.
Pot activists need more than 400,000 signatures for the issue to qualify for the November 2010 ballot. They say they will start collecting them in September.
I think we're doing the public a good service by giving them a chance to vote on it.
One San Francisco assemblyman has introduced a bill supporting the legalization of marijuana. He plans to hold hearings on the matter in the fall. Well, surgeons at 2 Washington hospitals have performed a record 7 kidney transplants involving 14 recipients and donors who did not match. The surgeons used a process called plasmapheresis, or plasma exchange. It virtually eliminates the chances of organ rejection. The process can make it easier for African Americans to receive transplanted organs. Of the 80,000 people on the kidney transplant list, 36% are African Americans, but only 15% of living donor kidneys go to African Americans. The transplants were performed at Georgetown University Hospital and Washington Hospital Center over a 4-day period in July. According to the hospitals, it was the largest kidney exchange of its kind in one city. Well, up next on Family Health Today, we're taking you inside Community Clinic at St. Francis House for a look at the healthcare services they provide to the Northwest Arkansas community.
Getting fit, eating right, and staying up on the latest health news. They're good habits that can help you look and feel your best. You can get the details on the top health and medical stories every week in the Arkansas Democrat-Gazette, the state's largest newspaper. Take a more hands-on approach to good health and pick up some good habits, like the Arkansas Democrat-Gazette.
Welcome back to Family Health Today. I'm Dr. Janette Nesheiwat. An amazing healthcare ministry is changing lives in Northwest Arkansas. We're talking about Community Clinic, a medical home for low-income and uninsured people in our community. Camber Horn-Brooks, Clinic Directors of Development, joins us to tell us all about the clinic. Camber, welcome to the show.
Thank you.
Now, tell us a little bit about the history of your program, of the clinic. When and how was it created?
About 15 years ago, a group of, concerned citizens or some faith-based folks got together and they decided they were going to do good in Northwest Arkansas. And so they pretty much provided all services available, financial assistance, utility assistance, but soon they realized the biggest gap in the area was in helping people without insurance get health care.
How many locations do you have?
Currently we have 5. At that time they were just in a small strip mall, maybe only open 1 or 2 days a week. And after about 2 years they ran out of resources. And Bernice Jones saw their plight in the newspaper and decided to offer them our first location, which is in Springdale at the Jones Center.
Now, I understand you have a brand new location opening up, is that right?
That's right. We right now, currently our Rogers location is in the previous Poplar House location, and the space is too small, and so with the Center for Nonprofits, the Northwest Arkansas Center for Nonprofits, we have a huge new space that we're going to open up on August the 25th with a ribbon cutting, and Governor Beebe's going to join us.
Awesome. That must be so exciting.
Yes.
Now, tell me about all of the services that you provide.
Well, we have full family practice. We offer pediatrics. We offer prenatal care for women all the way up through their 28th week of pregnancy. And our pediatric program offers all of the developmental things necessary for full spectrum of care. We are a federally qualified health center, which means services are provided regardless of ability to pay. So we're not a MediQuick or a free clinic. People come in for and see us as their medical home.
I see. What happens if you have a patient that comes in and it turns out they need to see a specialist? What happens at that point? I take it that you have, basic family physicians, practitioners, and pediatricians, but probably not any specialists working for you or with you. Is that correct?
We have some very generous volunteer specialists that take referrals from us and that also come in at different hours and help out our patients that have unique care needs.
Now tell me about your smoking cessation program.
Yeah, it is one of the largest in the state, and thanks to the support of Cancer Challenge, we're able to provide low-income and uninsured residents. We have behavioral classes where they can come in and get some support to help them stop smoking. And we also offer them prescription assistance, which is really, really hard to come by, especially if you don't have insurance.
Right.
Chantix, Wellbutrin, nicotine replacement. One of the ironies of the smoking dilemma is that people who from low-income families tend to have higher medical costs because of their smoking, but have the least access to be able to quit.
That's
so
right.
Keeping our doors open for them.
You also assist people with chronic diseases such as hypertension and diabetes.
Yes, and we have a diabetic educator and a nutrition counselor who comes in and actually works people with their program to help them comply with their treatment plan. And yeah, we do have our physicians regularly see people for hypertension, obesity, and diabetes. Diabetes is a large what am I trying to say there? Is one of our larger programs. A lot of the patients who access our services with us also have diabetes.
That's very important, especially for a patient that needs some insulin or their blood sugars are running too high. It's not just a one-time visit like a cough or a cold. They need regular routine care. So that's just phenomenal that they can receive that care at the St. Francis House.
Yes, thank you.
Do you offer preventative treatments, screening tests, for example, mammograms and colonoscopies, that sort of thing?
We have, again, from the support of Cancer Challenge, at our Rogers location in Rogers Medical there, we offer screening for prostate, breast, and cervical cancer. We also have resources for treatment should their diagnosis come up. And we also have a Komen grant, and so we provide breast health at both our Rogers and our Springdale location. And actually the Siloam Springs location also has a Komen support.
What do you do if a patient comes in, either doesn't have a job or can't afford to be seen? What are the steps taken? What do you do with those type of patients?
We offer a sliding fee discount, and based on the person's household size and their income, and if it is zero, that may be. And we don't make them even pay on the day of services if they happen to be without cash that day. We bill for that, and so if someone comes in, one of our patient advocates will sit down and talk with them about their proof of income and the necessary documents they need to get services.
That is just absolutely wonderful. Do you ever have to close your doors and say, we're full, we can't see any more patients, or we're not taking any new patients, or are you always accepting patients?
We have a rotation where new patients are accepted at all of our locations. We obviously are going to see our established patients first, but we offer a new patient orientation where patients can come in and sit down with us, and we offer the whole array of services that are available to them and help them fill out all the paperwork necessary for any kind of assistance they may need.
You know, all of these wonderful services that you provide for the people in our community, that's got to be expensive. How does the St. Francis House sustain itself? How do you keep your doors open and are able to provide for these people?
Well, in about 2004, the community clinic applied for a FQHC to become a federally qualified health center. And as a federally qualified health center, our funding source, the government, gives us a chunk of change to allow us to pay for our staff. That way we can keep our doors open, our staff is paid for, and then we also do have other supportive grants from the community, from the state, and from the federal level as well.
I see. What is your vision for the future of the St. Francis House?
Oh gosh, we've got so much expansion going on. From the Springdale site, we have a Springdale Medical, and we also have Springdale Dental, which is getting ready to go to a new building, so we'll separate those, which is going to allow us at the Springdale site to open up more exam rooms and hire more providers. We are really about access to care, eliminating health disparities, trying to give people the opportunity to come in and see a physician, not just when they're sick, but as their medical home.
Where can our viewers go and our listeners go for more information on the St. Francis Community Clinic?
You can go to the website, and it's www.communityclinicnwa.org, and you can also call the clinic.
Excellent. Kimber, thank you so much for being here today. We appreciate it.
Thank you.
Coming up, we'll take a look at how UPS is keeping its employees in shape. That's up next on Family Health Today, Jones Television, Channel 22. I'm Dr. Janette Nesheiwat.
Award-winning Jones Television, Northwest Arkansas's 24-hour nonprofit cablecast, is now on the internet. JonesTV.org features a first-hand look at what the station is doing for the organizations and people of your community. The site gives you access to the daily TV schedule, as well as various clips of shows hosted by local experts. And our community calendar gives local organizations the opportunity to promote upcoming events in Northwest Arkansas. Jones Television, Channel 22, bringing you timely community programming, public service announcements that benefit our nonprofit partners, and now an easier way to learn more about us. www.jonestv.org.
I'm Dr. Janette Nesheiwat for Family Health Today. Approximately 45 million Americans suffer from chronic headaches, and of them, 28 million suffer from migraines. We get more on this medical condition from the pharmacy.
A migraine can be disabling. With symptoms so severe, all you can think about is finding a dark, quiet place to lie down. Up to 17% of women and 6% of men have experienced a migraine. In some cases, these painful headaches are preceded or accompanied by a sensory warning sign, such as flashes of light, blind spots, or tingling in your arm or leg. Other signs and symptoms, such as nausea, vomiting, and extreme sensitivity to light and sound, also often accompany a migraine. Migraine pain can be excruciating and may incapacitate you for hours or even days. A variety of drugs have been specifically designed to treat migraines. In addition, some drugs commonly used to treat other conditions also may help relieve or prevent migraines. Imitrex was the first drug specifically developed to treat migraines. Related medications include Maxol, Zomig, and Relpax. From the pharmacy, I'm Carl Collier.
Hauling packages for a living requires a fair amount of strength and stamina. In today's Health Minute, Judy Fortin shows us how UPS helps its workers stay in shape.
22 years delivering packages for UPS has left Julia Carlson in pretty good shape.
I deliver between 160 and 180 stops every day, so I'm in and out of the truck between 350 and 400 times a day, and I'd say I walk approximately 2 to 3 miles on any given day.
Even with all that exercise on the job, Julia and her colleagues at a California package facility are getting a lesson in healthier living. There's a morning walk around the grounds, and twice a week some UPS workers head to a local yoga studio. Health and Safety Manager Mike Yates says the extra workouts help reduce injuries on the job.
To be a UPS driver, it's a physical job. You have to keep yourself in
I get a lot of FedEx and UPS.
top physical condition in order to perform the job safely day in and day out.
Do programs like yoga really make a difference? Driver Scott Stevenson thinks so.
Yoga has balanced my life a lot, home and work.
It's also given him more energy, just what he needs when he's delivering all those packages. For today's Health Minute, I'm Judy Fortin.
Thanks for being with us for Arkansas's only weekly medical report. If you have any health news or story ideas that you'd like to see on our program, we'd like to hear from you. Visit our website, jonestv.org, and drop us a line. Join us next time here on Jones Television, Channel 22. I'm Dr. Janette Nesheiwat.